Good afternoon and welcome to our series of webinars focused on bringing you information about COVID-19 related topics. The information in these weekly webinars is geared toward long-term care and skilled nursing facilities, but we encourage everyone who is interested to attend. My name is Kathy Caudill. I'm a communication specialist with Quality Insights. Today, we will be talking about the staffing measure for CMS's 5-star quality rating system. Everyone will be on mute, but we will be having a Q&A at the end of this webinar. So if you have any questions or comments, please send them to us using either the chat or the Q&A tool, which you can find in your Zoom menu. We invite you to join us every Wednesday at 2 p.m. for more webinars in this series. Next week, we will be talking about staff health reporting and vaccine hesitancy. We would also like to invite everyone who didn't make it to Quality Insights relaunch event yesterday to come to our encore presentation tomorrow at 1 p.m. If you have not heard, Quality Insights is kicking off the new initiatives set out by the Centers for Medicare and Medicaid Services. On Tuesday, we had a kickoff event reviewing these goals and how our organization can work with yours to help you achieve them. We will be rebroadcasting that presentation tomorrow and holding a live Q&A with the heads of our program, including the head of our nursing home project, Penny Imes. So if you were not able to make that event on Tuesday, we hope you can join us tomorrow, that's Thursday, at 1 o'clock. And I will drop the link in the chat shortly where you can register. With all that said, I'd like to introduce our guest today, Pam Metter. Pam is the Director of Regulatory Services with the West Virginia Healthcare Association. Welcome, Pam, and thank you for rejoining us today to talk more about CMS's rating system for nursing homes. And we have your screen up there ready with your presentation. So if you are ready, you can go ahead and take it away.
Wonderful. Thank you, Kathy, and thank you everybody for inviting me to come and speak with the audience, and thank you to the QIO for involving me in this wonderful Wednesday series that they have going on. And turn off my camera to prevent the distraction of, the face. So here we are going to be, today we're going to be speaking about 5-star staffing measures that have changed for 2022. Okay. Everybody that's in long-term care should be aware of what used to be known as the 5-star system, and now it's the Care Compare 5-star rating system. The 5-star rating system is based on the 3 areas, beginning with survey, staffing, and quality measures. Everybody knows that survey is the engine that drives the 5-star rating system. And the other 2, staffing and quality measures, is where you can either gain a star or lose a star. And we're going to talk about that process in just a little bit. The link that's here on this slide, and I'm sure that the quality improvement folks will be able to share this with you. This is the link that will take you to the technical users guide from cms.gov that will show you the ins and outs and all the math magic and all the stuff that happens in order to obtain your 5-star rating. Today, we're going to be focusing on staffing. The staffing domain is based on, there's 6 measures. There used to be 2, now there are 6, and we're going to go over the original 2 here. The first one is a case mix adjusted total nursing hour per resident day, which includes RNs, LPNs, and your nurse aid hours. It's quarterly, it's averaged quarterly for all days, weekdays and weekends. That's the first original measure. The second case mix adjusted RN hours per resident day per quarter. This is another one for RNs. Also now RNs are in both of these measures, and these are the old ones that we've always used. And again, the second one is for weekdays and weekends. On your screen now are the 4 new measures. The first new measure is a case mix adjusted total nursing hour per resident day, which is again RNs, LPNs, and nurse aid hours for a quarter averaged on all weekend days. So this one is just Saturday and Sunday. So weekends get a double hit. They get it for the original one, and they also get for their own Saturday and Sunday weekend, and RNs are in all three of them. The next one is the percentage of nursing staff that left the nursing home over a 12-month period. So this one is a turnover for all nurses, including RN. So RN is again included in this one. The next one is the percentage of RNs that left the nursing home over a 12-month period. Again, turnover, and this one is just turnover for RNs. The only one out of the 6 that does not include RNs is the last one, which is turnover for administrators. And it is another 12-month period, and it's not a percentage. It is the number of administrators that left the nursing home over a 12-month period. So it's, and there's a range, like if you've had no changeover administrators, if you've had 1 to 2 different administrators, and I'll show you that table in just a bit. So those are the 6 measures that we're going to be talking about. We're going to be looking at each one of them and determining how you're going to look at your facility and determine where you need to focus your energies in order to increase the staffing stars. This is just kind of a little kind of a summary about the domain itself. Where do they get those numbers? They get those numbers through the PBJ system, payroll-based journal, which is why I really encourage, if the folks that are on this call are not the folks that do the PBJ, they may need to watch a little bit of this to understand how important the PBJ system is, how important accuracy is. We just did a training not too long ago on the upcoming October final rule information. Much of the changes, especially in nursing and administrative staffing, relies on payroll-based journal knowledge. You can get tags in several different areas, how they cross-reference tags. If your PBJ is not accurate, if it's not completed timely, there are so many new things associated with PBJ that it's really important folks understand the role of PBJ and how it's to be done. The case mix adjusted information is based on your MDS 3.0. I don't have to tell you how important those are. The accuracy of your MDSs are for any kind, for several different things. So the case mix for your staffing domain is based on your MDSs. And then of course the turnover is also associated with your PBJ. And I'm going to show you how to find your individualized PBJ data. The link that's here also takes you directly to cms.gov, which is the site where the data is located. If you click on this link, it takes you to this site and it looks just like this. And then you're going to scroll down on this site. When you scroll down, let me move this. There we go. If you scroll down on this website, you are going to see this. When you see this, the nursing home, including rehab services, is what you click on. Now, this is in order to find your own facility's PBJ data, what CMS is looking at. I know you have access to it with your own, but this is what CMS gets their information from. So once you click nursing home, you're going to scroll, you're going to see this one down at the bottom where the red arrow is. It's provider information. There is tons of information in this data set. So once you click this, you're going to see this. You're going to see provider information. Now, over here to the right, it says download full data set. Do not do that. I will not tell you how I know not to do that, but 3 hours later, you might be able to look at the download. So, and yes, it was me, I did it. So don't do that. If you click this, every nursing home in the entire United States will be downloaded, and you would have to skim through all of that stuff in order to find what you're looking for. Instead, click this little funnel looking thing And I guess it is a funnel because you're funneling and filtering the information. You're going to click that. And I'm not going to go through how to filter. All you'll do is click the filtering, and then you're going to put in your 515 number or your whatever Pennsylvania. I'm not sure what the Pennsylvania Medicare or CMS number is, but it's the federal provider number. You can see this first one in Alabama. Their number is 0150009. So you're going to put, when you're filtering, you're going to put in your federal provider number, and it's going to pull up just your facility and your most recent PBJ information, plus all the other information. And later on, when I share my screen, I'm going to show you exactly what it looks like when you pull one of these up. I'm going to pull up another facility in another state. But if I wanted to go in and ask you guys, what's your federal provider number? I could pull up any of your facilities right now because it is public reported data. There's no secrets, and any Joe off the street could pull your information up and find out what your staffing levels are. So you're going to filter. When you hit filter and it filters, then you're going to download filtered data set. And that's when only your information is going to pull up. And again, I'm going to show you what that looks like. It looks scary and it looks like, but once you get used to looking at it and understanding it, you're going to really like this data set. Even if you hate data, which I'm not going to say I do, but you know, yeah, I'm learning to love it. I've learned over the last, I guess 20 years to love it, I guess. Okay. This next table, this next slide is the table that is the end all be all for staffing stars. This is located in that technical users guide I showed you at the very first slide. This is located within that. This is where you get your point range for your staffing ratings. So if you go on to Care Compare and you are a 5-star staffing, you've got 320 to 380 points. If you're a 1-star, you've got below 155 points. So, and then anywhere in between. The main focus of this is the fact that once you, and what are you talking about points? What do you mean? Well, I'm glad you asked me, because I'm going to tell you in just a minute how you determine what your points are and where this comes from. But most importantly, I'm going to explain to you why. Why is it important that we know where our points are? Why is it important that we know where it comes from? And what can we do about it? So in just a minute, we're going to do this. But this point, the star point table, is very important once we determine our number of points. Now, these are the staffing cut points table, and I realize it's kind of small because I sure can't see it very well. But what I want you to notice is there are 6 set sections. There's 6 areas. And what else has 6? Those are the measures. That each one of them has a staffing cut points. Each one of those questions that we had at the very beginning has ranges. So let's look at the very first one, which is adjusted RN staffing. So this is just basically RN, what your RN staffing is. And if you have between the minimum and the maximum, you find where you're at, and I'm going to show you that data set. That's where you're going to find this information, and I'm going to show it to you in just a minute, but I want you to get a base for this. When your numbers are anywhere in between those minimum and maximum for RN staffing, you find it and you write down that number of points. And then you do the same for the second one, adjusted total nursing staffing. You find where your facility's at, you find where the range is between the minimum and the maximum, and you write down the number of points. And I'm going to show an example. So if you need an example to understand what I mean, you'll get it in just a minute. So same thing for all 6 of the measures. The only one that's different is the administrators, which is the very bottom on the right side. If you have no administrator changes, you get a full 30. If you've had 1 administrator change, you get 25. If you've had 2 or more, you only get 10 points. So then you determine what CMS says yours is, and you write the points down. And that's where you get the points associated with what 5-star rating you are for that time. Now, so one of the first things we have to do is get our own points, minimum and maximum, so we can find our numbers and determine what our points are. So here's how it works. We take the 6 measures and we find the corresponding data for each of them, what we just talked about, find the corresponding points for the data set on the table, what we just talked about, add up all 6 of the points, and then we get our staffing rating on the red point range table. Just exactly what we just went over. But the next step is analyzing what to do with those numbers, with the data, and why do we need to know this stuff? So we're going to want to put our efforts into the area that will cause the biggest impact with the least amount of work and the least amount of money. And the examples that will make this clear, let's do an example. And I'm only using 3 measures because 6 was kind of difficult to go through and understand. So I'm only going to use 3, but please know there's 6 and I'm just not doing the other 3. This is just to show you what to do with these numbers, okay? So our facility, our adjusted RN staffing is 0.372. Our adjusted total nursing is 3.12. And our adjusted nursing on weekends is 3.172. So just by looking at the points table, which would be the easiest to move point-wise and why? And I thought when I did this first, I was like, they're never going to remember the point ranges. I don't know the point ranges, and why should they? So I did this. So take a minute. I don't want you to put anything in chat. But I do want you to, if you have a pen and a paper, sorry, right there with you, I want you to look at these numbers, and I want you to find on the first one, adjusted RN staffing. I want you to find 0.372, and I want you to determine which point range you would add for your facility. Where does it go? In between minimum and maximum. And then I want you to do the same thing for adjusted total nursing staff. Find out in that section 3.12. What point range, where's it at, and what's your points? Same thing with 3.172. Look at the point ranges, determine where it's at, and add your points up. Now, while you're doing that, and I'm not going to wait very long because I don't want this webinar to last an hour or 2 hours. If you have, I'm just going to go on to the answer. So we looked at our adjusted weekend points table. It's 2.985 through 3.173 for 25 points. So right here is the adjusted total nursing. I started it on the front. The weekend, we are at 3.172. We bring it up. Bringing it up, 0.002 would give us 30 points on the chart. Okay. So what I'm saying there is, if you look at 0.372 and you find it on this map here, or on this table, 0.372 is right in the middle, and it's 30 points for adjusted RN staffing. The second one is 3.12, and it's 30 points, and it is right there at the middle of the 30 points. But if you look at the weekend, 3.172, it is right on the cusp of being, instead of 25 points, 30 points. So if you increase that by 0.002, you're going to move that up 5 points. So which one of these would be the smart thing to work on within your QIN-QIO team or whatever? Which one of these 3 would be the best test to increase, and the least effort with the least amount of money to increase your staffing points? And the answer is the 3.172 for the weekends. That would be the easiest. It would be the one that would require the least amount of adage or work or math magic or whatever. It's the easiest way to increase your points instead of trying to increase it so much. So that's one reason why you want to know how to look at these things. If you were to focus on the others, you'd be doing a lot of work in order to increase it by 5 points or 10 points. This second one is, this last weekend one would take a lot less work. So let's do a little deeper example. We've got 3 measures: the adjusted RN staffing, total nursing staffing, and adjusted nursing on weekends. Which one should we focus on? So let's look at the same thing. 0.372 is, let's see, where's 3.372? It is right there at 30 points, but it's like right in the middle, isn't it? And that's the adjusted RN staffing. 3.442. Let's see where that is. 3.442. Okay, that one is right at 50 points, and it's right at the bottom. So you got to be careful. You won't be, if you lose a little tiny bit on this adjusted total nursing staffing, then you may go down 10 points, and we don't want that. And then the last one is 3.182, and mine is like, I'm not able to see it because of the bottom. So the adjusted total nursing hours is 3.442. This is total nursing hours, so we need to look further at our PBJ. Now, why is that? What if you were to look at the total nursing hours and your automatic response is to increase your RNs, which is fantastic because, as you know, RNs are on 5 of the 6 things. But what if you feel like, oh my gosh, we've got so many RNs and our RN staffing is fantastic. I don't know why this total nursing staffing is so low. You're going to look at your PBJ and you're going to dig a little deeper, because you can get the same kind of range for LPNs and nursing assistants. And if you're right on the cusp of increasing your total nursing by adding a nursing assistant or adding a LPN, number one, they're much easier to recruit. There's not as many RNs out there to pull from, but it's also a lot less labor costs. But if it gives you your goal and what you need for staffing, and it pushes your total nursing staffing hours to the next 10 points, then you've done your due diligence, and you've really utilized the data in order to show what you need to do, what you need to use in order to make your staffing stars applicable and able to increase them and use them as much as you possibly can. So, okay, now, I hope that made sense. If you don't understand, if you still need some more assistance with that, and you need to find your PBJ data, your QIO is so wonderful to help with this kind of thing. And if you need me to help you with any of this, they will reach out to me. We're such a good team. We all work together really well. We've all been in long-term care for a very long time, and we are here to help. So please reach out if you need more information. Now, let's think about the overall rating change. Why is it important for us to look at our staffing? Previously, facilities that obtained 4 or 5-star rating got an additional star at the end. So, and I'm going to explain this to you in a minute, but they've taken that away. So only nursing homes with 5-star ratings will get an increase in their overall star rating. So if your facility is a 4-star staffing, it's important for you to look at this and see how you can get that extra star. So let's say your survey was a 3-star and you've got 4-star staffing and 2-star quality measures. You're going to stay at a 3-star unless you can pull your staffing up to 5-star, and that will give you 4-star overall, which I'm sure I'm going to explain to it a little bit right here. So we start with the health inspection rating. Let's say, like I said, your survey was a 3-star. You're going to be able to add a star if your quality measures is 5-star, not 4-star, not 3-star, not 2-star. You're going to be able to add a star for 5-star quality measures. But if you're a 1-star quality measure, you lose a star. So there, if you started with 3 and your quality measures is a 1, you're down to a 2-star overall. And then they do the same exact thing for staffing. Add a star for 5-star or remove a star for 1-star. So my advice is, if you're staffing especially if it is a 1-star. If your staffing is a 1-star, this needs to be a priority. This needs to be a priority for your facility to get it off of 1-star, because you're just losing a star for absolutely not either your PBJ is incorrect or your staffing is poor, if that's the case, or maybe your PBJ person isn't putting people in the right spots. If you think you've got adequate staffing, you know, this needs to be a real prioritized focus. Okay. Now I am going, remember I told you, I'm going to turn this off. I told you I was going to show you, okay, I was going to show you an example. Let me start my screen share again, maybe. Screen share. Sorry, guys. Okay, share. You should see a Excel PowerPoint. Do you see that, Kathy? An Excel?
Yep, it's up.
Fantastic. Okay. This is what, remember when I told you to go to the download the data and only download the filtered data? Don't do it for everything. This is what's going to pull up when you open up your facility. This facility, 10560, is an Alabama facility. And I chose this one because of their star rating for, and this is old. So if you pull up this facility, it's going to have a different star rating than when I first did developed the training. So don't get me for that. They're probably different. And as you can see, when you pull up your facility, this is what you're going to get. And I don't want to make you sick, but I want you to look at the amount of information that you're going to pull up about your facility. Everything from survey, quality measures, staffing, tons of information on this download. And originally what I started to do was to tell you your staffing information starts on AI, which is column AI. But then when I pulled it up on live on the actual CMS data, that's not the case. They've added stuff, they've removed stuff. So I cannot tell you to go to AI, which is here. I can't say go to this column and this will be what you're looking for. What I want you to look for is the names here. Staffing rating is where it starts, because over here, short stay quality measures, long stay quality measure rating, all of this, health inspections, all of this stuff is in here, but you're going to be looking for your staffing rating. And you can see this facility, their staffing level, their staffing rating is a 1. And they need to really work on their staffing, but we don't know where yet. So let's talk about the 6 measures that we are going to be looking at their points. And I also did a, if I do that, can you see the Word document staffing example?
I don't see a Word document. You might need to do a reshare of your screen.
Okay, well, I'll do that in a minute. You still see the Excel?
Yes.
Okay, so I will reshare. I'll stop the share and then do the sample, because I've got all the points written down that we're going to talk about, and you'll be able to understand it rather than going back and forth. So let's talk about the first thing, which is the adjusted RN staffing. Okay, when we find the adjusted RN staffing, we're going to look at all of these to try to find adjusted RN staffing. And I don't want to make you sick, but oh, look, adjusted RN staffing hours per resident per day. So that's where you find this facility's number. Remember I told we looked for the range, the minimum and the maximum. Their number is 0.23554. And rather than bringing up that table again, I am just going to tell you, because I promise I'm not lying, their points for adjusted RN is 10 points. So for that, their adjusted RN, they only got 10 points, and 100 points are possible for that. So they only got 10 points. Now, the next measure was adjusted total nurse staffing, total nurse. So let me find it. I think it's the next one. Yep, adjusted total nursing staff hours per resident day. And it is 3.11068. So their total nursing staffing is 30 points, which is still, I mean, that's still a little low, but it's still, you know, better than 10 points. Then we're going to look at the next one, adjusted total nursing staffing on the weekends. Now, this one is a little funky. There's a couple of places that this could be, two places. I'm saying it's this case mix because it is adjusted, and there's another one up over here that it could possibly be, but it didn't say weekend. So we're just going with this one right now. And here is their numbers, 3.01504. And that range puts them at, and this is the weekend, case mix on the weekend, that puts them on 25 points. Now let's do the next one, which is the RN turnover. Now, RN turnover is one that's, it's harder to impact your numbers quickly with turnover, as you guys know, as opposed to the other ways of increasing your staffing. But their RN turnover is at 42.9%. And that puts them at 35 points, which isn't, I mean, that's not horrible. It's less than half for a 12-month period. And then the next one is total nurse turnover. That's here, total nurse turnover. And that's 60.7%. That's way more than half of their total nursing. And that number is only 15 points. So they only get 15 points for total nurse turnover. And then let's look at the administrator total, which is number of administrators who have left the nursing home. There's a 0. So they get the full pointage on that. They get 30 points for their administrators. So let's say we add all of that up, okay? And I'm going to show you then my other document, if I can find it. Let's see if this is it. Yes, here's all those put together, all 6 of those measures with their data numbers and then their points. So we add up their total points, and if you'll remember, a 1-star facility is anything less than 155 points. So that is where they get their 145 points from. Now, what they need to do, which I did not do, they're going to take this data and they're going to see which one of these with the least amount of work, probably one of the first 3, which one of these with the least amount of work and the least amount of money, which one of these 3 are we going to be able to impact our staffing points, 5 or 10 or whatever. What's going to get us out? They only need 10 more points in order to get out of the 1-star, 11 more points to get out of the 1-star range. So they're really going to need to look at this and see what they can do. Because if they're out of the 1-star range, of course, they want to continue to work on it and make their staffing rating higher, but they're not penalized. They're not penalized with a 2-star, 3-star, 4-star. They're not penalized, but you are with a 1-star. So you need to pay close attention to where that's at and how you can get that 1-star back with only adding your 5 points with your QAPI projects or with looking at your data and making sure that the PBJ data is being put in, all of your RNs are being counted correctly, and all of that information is accurate. So, okay, I am going to go back to my PowerPoint. Maybe. I think I shut it down. Of course I did. Let's see here. Yeah, I did. Let's just go back to where our faces are, our little happy faces. So that was the extent of the training. I'm going to turn my little camera back on and put my glasses and move everything back into spot. And I'm going to see if anybody has any questions, comments, snide remarks, anything you've got to talk about. Hope you found this very helpful.
So in a minute, we'll start the Q&A portion of this meeting. If you have any questions, you can enter them into the chat or the Q&A box. And while we are waiting, we'll pull this up. I'd like to let everyone know that I will be emailing the recording and the slides to this presentation to everyone who registered for the webinar. So you will be receiving those later this week to the email address that you registered with. And again, I'd like to invite everyone to our webinar next Wednesday at 2 p.m. on staff health reporting and vaccine hesitancy. We also host office hours live chats twice a week. So if you're looking for one-on-one advice for your facility, you can pop in during our office hours and shoot us a message, and someone will be there to answer your questions. Those are every Tuesday at 8 a.m. and every Thursday at 2 p.m. And you can find the links to those live chats and our webinars and more in the newsletter that we send out each Friday called the Last Minute Lowdown. And if you would like to receive that newsletter but don't think you're on the mailing list, you can email me and I will get you on that list. My email is ccaudil@qualityinsights.org. That's ccaudil@qualityinsights.org. And I will drop my email in the chat shortly so you can have that on hand. And let's see, we don't have any questions so far. Want to give it another minute. Did you want me to pull your PowerPoint back up? Was there any other slides that you wanted to show? Okay.
That was it. That was it. I think that's enough. If they want, and if you guys want copies of my examples, if anybody requests that, let me know and I'll be happy to send it. What's
your email, Pam?
My email is pmetter@wvhca.org. I'll put it into chat so that
would be great for everybody to have that on hand too. And I can include
put
that
it into
in our follow-up email too. All right, we're still not getting any questions, so that means you explained it perfectly.
We'll say that's the reason. I don't think this lets me do it to all. I'll just send it to you and you can put it to all. How's that?
Okay, I'll copy and paste. Yeah, I'll do that. One moment.
Perfect. Perfect.
Here it is. pmeador, PMEADOR @wvhca.org.
That's it.
There's that. All right, and before we head out, I'd like to one more time invite everyone who didn't make it to our relaunch event on Tuesday to come to our encore presentation tomorrow at 1. It is a great way to learn more about our organization and the services that we can provide your facility or organization. That link is in the chat, and I think I'll drop that in one more time because I think that if you came late, you can't see the chat from earlier, and I will drop my email in. So there's all of that. And if you want to go ahead and save that before we wrap up, there's 3 dots in the chat where you can save and download the chat. So if you're like very quickly trying to copy paste everything that we put in there, I know I only found out about it last week. I'm really excited.
I did not know that. That's good. That's good to know.
It's really new for you. It's been there the whole time.
Fantastic.
So I think that's it. One more thing before we wrap up, I wanted to say that you can check out our other interviews by visiting qualityinsights.org/QIN/multimedia. You'll also be able to find the recording of today's webinar and the presentation slides, as well as a transcript on that webpage later this week. Pam, thank you for joining us today, and I'd like to thank all of you for joining us today.
Thank you for having me. Y'all take care.